The information found in this podcast is not a substitute for help from a licensed mental health professional. Hi, and welcome to the Women in Depth podcast. I'm your host, Dr. Lourdes Viado. Join me as we explore the inner lives of women, their struggles, fears, hopes, and dreams. We'll go beneath the surface and take a deeper look at what is hidden, unknown, uncertain, and uncomfortable. Hi, and welcome back to the podcast. I am excited today to welcome a colleague and friend, Arianna Smith, who is here to talk to us about toxic and abusive relationships. And what we're going to learn from Arianna will be about, what these relationships look like, what it can feel like to be in one, understanding how to navigate this if you find yourself perhaps in one of these relationships. If you have a loved one who might be in a relationship that's abusive or toxic. We'll also talk about myths and misperceptions and some first steps for moving forward, whether you are in need of recovering or healing from this, or if you are concerned about a loved one who may find themselves in a toxic or abusive relationship. Arianna is a psychotherapist and copywriter based out of Denver, Colorado. And by intuitively weaving IFS, internal family systems, and EMDR, she guides highly sensitive people and LGBTQ individuals to process childhood trauma, recover from abusive relationships, and release the cycle of constant people-pleasing. Therapist by day, copywriter by night, Arianna supports fellow healers to craft the right words that showcase their passion, personality, and expertise so they can have a practice filled with dream clients. Hi, Arianna, and welcome.
Hi, Lourdes. Thanks so much for having me.
Well, thank you for agreeing to be on the podcast and to talk about this. I think it's such a relevant topic and it touches so many lives, whether people are aware of it or not.
Well, and I think it's good to preface, you gave an overview of what to expect from the podcast today. I think it's also good to preface for our listeners that this is a heavy topic. And so if they've experienced an abusive relationship or know someone who has or are currently in one, this is a heavy topic and it's good for them to be gentle for themselves. They might find that they want to take this podcast in bits, listen with a friend, send it to a friend, do something grounding while they're listening to it, like baking or walking, and also acknowledging that, they may get triggered and then can possibly process that with a helping professional that they're working with. I also like to start this, and we might go more into this when we talk about some of the myths or misconceptions, but also wanted to start this conversation with acknowledging that, abuse and toxicity in relationships can show up in all types of relationship structures, romantic relationships, and also in all types of identities, right? I think sometimes we have this unfortunate Lifetime movie concept of what intimate partner violence or toxic relationships can look like. I also think that toxicity and, unhealthy relationships can be like glamorized. But for all the listeners out there, I just also want to acknowledge that, and Lourdes, you and I talked about this beforehand, there is so much to this topic and we might not even really get fully into the intersectionality of this topic. So for example, you are part of the LGBTQ community and in a toxic or unhealthy relationship, that's a different experience than if you're in a straight cisgender relationship.
So I like to start, Arianna, with kind of the building blocks and the basics, just because, we have listeners who are coming from all different experiences and levels of knowledge about the various topics that we have here. And I wanted to start with what is a toxic or abusive relationship? And also, a lot of words get thrown around with this and they kind of sound like they're one and the same, maybe. And so if you can also help to maybe discern between some of these.
Yeah, so you'll hear the term domestic violence and intimate partner violence, gender-based violence kind of used interchangeably. I think it's important to differentiate between an abusive relationship and a toxic relationship. And maybe a good way to look at it is a Venn diagram. And abusive relationships can certainly be toxic in their own rights and unhealthy, but not all unhealthy and toxic relationships are inherently abusive. That's something that is important to distinguish from the very first place. So I think what's important to know, there's a couple important things to know about abusive relationships between partners. One thing to know is that often abusive relationships and abuse in relationships is future oriented. It's about the person who is abusive is using power, control, intimidation, threat, physical, all emotional, all types of threats or actual violence to control the partner. And so a way to think of it is it's future oriented. It's getting the partner to do something or to not do something. The thing with a toxic relationship is that it may not necessarily be so calculated. It might be more reactive. It may be someone in the moment that just gets overwhelmed and doesn't know how to manage their emotions and so lashes out at their partner. In that case, is it calculated? Is it meant to control the partner? It gets very nuanced here.
Ari, can you give a couple of examples of what an abusive relationship might look like or feel like for the person who's in it? And then also maybe an example of that for a toxic relationship, just to give some idea to our listeners.
So, one of the things to know about intimate partner violence, domestic violence, is that it is quite dangerous, can be quite lethal. It is often cyclic and it escalates. So, that's what the research has shown us over the years. If we compare that with a toxic, unhealthy relationship, you may or may not see. So, if we're going to understand those three qualities, possibly lethal, right? Cyclic, it escalates, and then also the power and control component that may or may not be present with a toxic or unhealthy relationship. So, for example, there is a cyclic nature to abusive relationships where there is often, I don't have the exact cycle in front of me, so you can certainly look this up, but inherently there is usually a tension building phase. There's that walking on eggshells. Then there is often the explosion, which is when the abuse happens. Then there's the recovery, the honeymoon period, and that usually cycles back to then tension building, the explosion, the recovery, honeymoon period. What I think is important for listeners to know, and if people are in an abusive relationship or love someone who is in one, is that research has shown is that over time, that cycle escalates into more and more harm and more dangerous abuse happening. So that's why it is something to take very seriously, because if there are those dynamics of power and control and abuse, then if we are just going off of what the research shows us, it can lead to very disastrous impact. Now, I throw on this nuance because having worked in a domestic violence shelter, what we also know is that the most lethal time for someone when they're in an abusive relationship is actually not necessarily when they're in it, but when they're trying to leave it or after they have left. And so that's why when I was working at a shelter, we knew how important it was for the individuals and families coming to us to have really thoughtful and thorough safety protocols, because we knew that that could possibly be the most dangerous time that that person and or their family had been in that relationship. Now, if you compare that to a toxic or an unhealthy relationship, those components may or may not be present. So there may be harm being caused, there may be damage, obviously, but there may not be necessarily that fear for someone that, oh gosh, if I leave this relationship, they're going to harm me, they're going to stalk me, they're going to follow me, they're going to come to my place of work. There might not be the same cyclic nature with a toxic or unhealthy relationship. Usually there are cycles to that, similar to what I described, but it might not naturally escalate like it does with intimate partner violence. So it might just be these big blow ups every couple of months. it gets resolved. It might go up and down, but you may not see that same escalate, like that same nature of how it escalates and how cyclic it is. And I also like to say that, something like I also want to validate toxic and unhealthy relationships are damaging. They are volatile. They can be really subtle and insidious, and there can be dynamics that are abusive. So when someone is in those relationships, instead of necessarily saying, well, here's a checklist that tells you, I often invite people to turn inside and ask themselves how they're feeling inside and trusting their inner wisdom and their inner guidance to let them know as well. So they might be getting some external information around, gosh, like this doesn't really seem entirely healthy, but also they might need to turn inside and listen internally to what they're feeling as well.
Arianna, can you share with our audience how you came to be familiar with this topic of abusive or toxic relationships?
I started my career in the helping profession working for a sexual assault hotline. And so I'd go to my day job, and then by night, I would respond to the hotline and support survivors. This was a sexual assault hotline. Eventually, that led to working at a domestic violence shelter where I worked and supported women and their families who were leaving abusive relationships. And so then eventually that transitioned into me going to graduate school to become a therapist. And part of what led me to want to move from working at this shelter to working as a therapist is that when I was working on the hotline, when I was working at the shelter, I was there to help folks stabilize. I was there to help when the crisis was happening, but not necessarily helping people and guiding them on the other side of the crisis. And so what would happen, what I saw is that if individuals, and not all folks get to do this, but if they didn't have the opportunity to really heal from that previous experience, they often were vulnerable to get back into the same cycles of abusive relationships. And so part of moving to be a therapist and getting my training in EMDR and IFS, which are great approaches for trauma and relational trauma, was to have those skills to support those who were on the other side of it, that had recovered, they had gotten out of an abusive relationship, or they were finally waking up to just, wow, I've only been in toxic relationships. I don't really know what it's like to be in a healthy relationship. So being a therapist, I was able to support them and asking the hard questions and doing the hard healing so that they didn't have the same vulnerabilities to go into another relationship of the same type.
Thank you for sharing that. I think that that is so important, that similar to what you share later about the most dangerous time not necessarily being during a toxic or abusive relationship, but afterwards. I think this also speaks to, it's not just about getting out of the abusive or toxic relationship. Actually, the real work begins after that. And if it doesn't happen, there is a high risk of this person finding themselves in a repeating pattern.
Right. There's so much that can make someone vulnerable to being in an abusive and toxic situation. And it's very normal if you're in that situation to blame yourself, to minimize. But when I am working with clients around this, often what I ask them is, when did you first start ignoring your gut? When did you ignore that first sign? When was there something that felt off? Because often what happens is we're noticing those nuanced cues. And then depending on if we've done our healing or not, depending if we have the support or not, depending how supportive and healthy our upbringing was, right? Like our initial relationships with caregivers is how we interpret that information and determine, oh, this was nothing. This just wasn't a big deal. I'll stay in this, right? Or being like, actually, that doesn't feel good. And I don't know if I want to engage with someone like this. Or that doesn't feel good. I want to get more information about this and see if this is something me and my partner or partners can work on.
So, Ari, I'm so glad that you emphasize how important it is for individuals to really pay attention to what's happening internally, not necessarily the external cues, because I think just overall, this is a life skill that so many of us struggle with. We get pulled into what's happening out here and stop hearing or valuing or recognizing what's going on inside.
Right.
And so, you were mentioning that, when you work with your clients, you may ask things that sound like, when did you stop paying attention to your gut? Or when did you first have thoughts that maybe something was off? And so I'm wondering if you can share a little bit more about this in terms of what are some other common experiences that someone who is in an abusive or toxic relationship may have that can indicate that, hey, this is not a safe, healthy relationship for me.
Mm-hmm. One of the things that you might be feeling, or someone might be feeling, if they are in an abusive or toxic relationship, is questioning their reality. So questioning, so here I say, like, I ask folks, when did you first start? Like, when did you first ignore that first moment of discomfort? Or and at the same time, what I have found with folks who have gotten on the other side of abusive relationships is they question that, right? So if you're in this experience or on the other side of it, you might question your reality. You might say, you might minimize. I notice that with a lot of folks, there's a lot of self blame, such as I deserve this, or, well, it was my fault. A lot of self criticism, especially once they've gotten out. For example, why did I stay so long? Why did I allow this to happen? I think it's worth noticing if you find yourself either thinking about what has happened, if you're having flashbacks, intrusive thoughts, which, when you have just thoughts come into your brain out of nowhere and you just are in the middle of a work meeting and suddenly you're thinking back to the argument and you can't stop thinking about it. On the other side of that, there's the completely pushing or blocking it out, right? Having moments where you don't even remember what happened in your relationship because it was so difficult. It's also pretty common for folks that have gotten through and survived an abusive or toxic relationship to have gotten used to minimizing their feelings, like explaining away their behavior of their partner. It wasn't that bad. And with this one, I want to validate that this is a survival technique, because often when you're in these situations where there is abuse or volatility happening, you have to minimize in some way in order and contain and compartmentalize in order to go about your day, right? Because otherwise, if you sat with the full gravity, what was happening to you or your children or your pets or your loved ones or your life, it could be so incredibly overwhelming. So with all of these internal experiences that might be happening, I want to just keep on a load of compassion for there's a reason they're happening and they're helping you survive. Other things that might be happening for folks is that what I've seen is once they're out of this situation and they're dating someone new, they find that they still can't fully commit to their partners. They always have a go bag, even if it's an emotional go bag, right? Like, I'll never fully let them see this side of me. Never fully let them know this about me. Or even if it's just a physical go bag of making sure they always have their own separate bank account. And I'm not to say that those things aren't inherently bad, right? Because we do want to have a sense of autonomy. But I think what's looking at is the motivation behind it, fear, right? Is it the fear that they actually can't see me or that they're going to hurt me?
This is so helpful, Ari. I just want to tell you that, you know, what you were sharing about some of the signs that
Mm-hmm.
someone could experience internally and also externally. I see this with my clients so often. Just a lot of taking on way more responsibility for the challenges in the relationship. And there's this magnification of their role in the problem and a dismissal, minimization of the others.
Well, it can create this dynamic where one partner takes on, and I think Brene Brown talks about this. This isn't a new concept, but she has a podcast that talks about over functioning and under functioning. And so, in order to cope with the stress of the relationship and the toxicity of it and the volatility, you step into that over functioning role. And you actually might be the quote unquote controlling one when really the relationship feels so unstable and so unsafe that you just want to have any type of control over what's happening. And I think you see that aspect a lot, that dialectical, that feeling of being out of control in a relationship and wanting to control when one of the partners has unresolved or untreated trauma, if there is addiction present, untreated, like unsupported addiction, right? People can be in recovery and still be in healthy relationships. And it leads to this myth of abuse is just because they're angry or because they have a trauma background or they were abused as a child or they're only mean when they drink, right? And that's where this is circling back to the abusive versus toxic, because there are bunches of people that have, that use substances, whether or not there is addiction, that have had a trauma history, that have anger, that have trauma, that don't abuse their partner. And that's where it can be easy to minimize. And that's where, if you're a very empathetic person, you can be like, oh, well, it's because of this. And what I always say is, alcohol, addiction, anger, none of those create abuse, right? Abuse is a choice. Now, when we look at toxic relationships, right? If someone may or may not be, let's look at maybe a toxic or unhealthy relationship where we assume abuse isn't present. It can still be toxic because one partner might not be in the place where they want to look at their relationship with alcohol or substances, right? That may not be abusive, but it may feel toxic and volatile because of the episodes that happen when that partner is drinking.
Right.
Does that make sense?
Absolutely. And I think too, in toxic relationships, like the example that you just used, where we're assuming that it's not abusive, you can also still see the manipulation and those dynamics of power and control coming into those also still.
Mm-hmm. Well, and that's something I wanted to touch upon too, is when we're in a relationship, there is often, and this can be a nuance in either a toxic or abusive relationship, but speaking of power control, there may be a power differential, right? So, and assuming this relationship has two people in it, there might be a power differential where one person earns more money than the other, right? Or if it is an LGBTQ couple, one partner might be out and the other might not be, right? There's a power differential there. There may be a power differential around privilege, right? If they are white, if they are cisgendered, if they are college educated, if they have citizenship, all of those can create a power differential. And so when that power differential is used to harm, that can be a red flag, right?
Okay.
If that power differential is used to make the other partner that has less power, less privilege, do something or not do something, that's a hallmark of an abusive relationship.
So, can I offer an example? Because I think this is one that can come up sometimes, and I just want to get your insights on this. So, if you go with the example of a couple where one is the breadwinner and one is a stay-at-home parent,
Mm-hmm.
and the one who is the breadwinner, who is possibly a toxic or abusive partner, may make statements like, you need to figure out what you're going to do if you decide to leave because you're not taking the kids, or you're going to have to find a job, or those types of comments.
Yeah.
What are your thoughts on that?
I think this is where, and before the show, you and I talked about the power and control wheel. I think that is something that, listeners can look up. I invite them to look at an inclusive power and control wheel where it's identifying all the different ways that abuse can happen. And what you're describing might be considered financial abuse, such as limiting that person's access to funds or controlling how they spend their money, or shaming them how they spend their money, right? And if you look at it, it's all trying to control that person. It's all future oriented around getting them to do or not do something. And this also highlights, and this is just where we get to bring in like tons of compassion for anyone who's in the situation and been in this situation. It's never that simple, right? It's never that simple. It's never, and that's what I often say to clients and individuals, like, if you could leave, you would. But if you love them, right? You might have had children together, you might have a home together, you might have this extended family together, you might own a business together, right? It's never that simple as we might hope it is or think it is.
So you've touched on this already, Arianna, about how prior trauma, maybe growing up in an environment that was abusive, how this makes an individual more vulnerable in many ways to finding themselves in an abusive or toxic relationship. Can you share a little bit more about that?
Yes, this is a huge aspect, especially once someone is maybe out of a relationship and dating again or in a serious relationship again. And so, what I often encourage folks to look at is to examine what things were like when they were growing up, because that's the foundational way that they learned how to relate to other people. And often we might talk about attachment. I'm sure people have heard a lot about attachment styles, but what can make someone vulnerable to being in an abusive or a toxic relationship is if, when they were a child, this is just one example, they were a child, there was abuse, neglect, instability, chaos, stress, because that's going to impact how you learned, the foundation for how you learn to feel close to someone and feel safe to someone. And so often for individuals who've gone through childhood abuse and neglect, what they learn, often unconsciously, is people aren't safe, right? But also at the same time, and I feel like the pandemic really hit this home, but we need people, right?
Yeah.
We need people, we need relationships. When we are all in
Yes.
lockdown, we're like, gosh, I never thought I'd miss
Right.
seeing my neighbor, like,
Yeah.
yeah. And one of the, and we heal in connection to ourselves and others, but we also are social creatures, right? So one of the things that I will talk about is trauma glasses. I use the term trauma glasses, that if someone has gotten out of an abusive or a toxic relationship, they're in something new, and they might have their trauma glasses on, where everything their partner does is like, oh, that's abusive, oh, that's toxic, oh, that's unsafe, right? And
Right.
so
Right.
that's an right? We can have our rose-colored glasses like in the honeymoon phase, right? But then we can also overlay that with our trauma glasses, which is like if a partner is doing something that a previous partner did, we automatically assume that there's something bad about them. And you've talked about this in other podcasts. I think our amygdala is super helpful. Like if we are getting
Yes.
triggered, right, by a partner, if we're making snap judgments, then chances are our amygdala is running the show and making the decision. And for those who haven't listened to the podcast around the amygdala, it's basically our fight or flight. It's our part of our brain that tells us if there's a threat or not, and often doesn't bring in much nuance and gray information to making the decision.
And I think too that, when you grow up with experiences where you were abused or it was chaotic and unstable, I think that you also become comfortable with this.
Yep.
You get used to it or desensitized, which I think is also a factor in why people who have had difficult or traumatic prior experiences find themselves in this pattern. And then I think that builds on this sense of what's wrong with me. The shame of I'm always in these types of relationships. Why can't I do something different? And I want to go back again to the compassion and, telling this person, and if there's someone listening who is hearing this, that your reaction to trauma, what you're experiencing, is normal when you think of what you've been through. And This is, one of the things that I've always found to be so powerful is that trauma changes the brain. And that's why this work, this recovery is so important when you have been through these types of experiences as a child or in your relationships. Yeah.
I'm so glad you brought this up, because it's often, you've gotten out of this abusive or toxic relationship, or you've gotten out of multiple of them. You might start to blame and being like, why do I always pick the bad types, right? Why do I always pick these? And so once you start to do the healing work and finding a supportive provider can help, because often what you've learned and what your brain has learned, right, is that chaos feels normal. So if you're in this new relationship and you're with someone who's stable and healthy, and granted human, like we're still in a relationship with imperfect humans, you might still feel this underlying sense of anxiety. You might still feel this boredom because like things are stable, right? And so that's when someone might even create chaos themselves, because then it's a way to be in control, right? Because our brain wants comfort. And so if all we've known is chaos or abuse or instability, then if we're not getting that, then we might create that. And this is obviously, I'm saying this in a way like it's conscious. Like it's very
Right.
rarely that someone's like, I'm really bored. I wonder if it's because I'm used to being in an anxiously attached relationship. And you know what? I'm going to pick a fight so that I feel like I have a sense of control right now. Like that's not just
No, it's not
not how
conscious. We don't actually go through those steps in our
right,
minds.
right.
Yeah.
But as you start to work with someone around this, you can start to have that clarity around, okay, I'm feeling anxious. And this is where the trauma glasses, I kind of refer to those, because then you can take off the trauma glasses and you can see your situation clearly and not through that lens of something bad is going to happen. And then you can see, you might take off your trauma glasses and still see this partner isn't good for you, right? Or you might take them off and see, oh, they are good for me. And this is how we have to work together to make this relationship work.
I'm so glad that you shared this about the trauma glasses and how actually being in a healthy relationship can feel very anxiety provoking because it's different and new. And I think this is a good segue, Arianna, because I think any regular listeners to the podcast know, and your clients know, you and I are also highly sensitive persons, and we specialize in working with individuals with the trait of high sensitivity.
Yeah.
And I wanted to also bring into our conversation the intersection between HSPs and this toxic or abusive type of relationship. And one of the things that kind of stood out to me when you were sharing right now was how for HSPs, novelty is stressful and we like familiarity. Right? And so I was thinking when you were saying that, yeah, I can see how even for HSPs, this kind of makes it a little bit more challenging. And so I thought that this would be a good segue. I'd love to hear your insights on abusive and toxic relationships and, things to consider or just to keep in mind when you also consider someone with the trait of high sensitivity.
Yeah. Well, I'm a huge nerd about this
I love it.
and have thought a lot about this in pure HSP fashion. To simplify it, which, if you look at the 7 pages of notes I have, but if to simplify this topic, I love whenever I'm looking at the intersection between anything and HSPs, I like to overlay it with the DOES acronym. And for those who aren't familiar with the DOES acronym, what I love about this acronym is it's a good, simple way to quantify what they've shown in research and just in studies and anecdotally around HSPs. And so the DOES, the D stands for depth of processing. The O stands for either overstimulation or overwhelm. The E stands for, I've heard, emotional reactivity or empathy. And then the S is sensing of subtleties. Is that your understanding of acronym
Yes.
too? So if we look at each of these, and I feel like this could be its own podcast if we're being honest.
Yes.
But I think our listeners, who are probably deep thinkers, can start to look at ways that this acronym shows up in their life and how it might show up in their relationship. So the depth of processing, this is where you are an HSP might, and this is someone, their own experience and also what you might be perceiving for them, is you might see that they need to spend a lot of time thinking about the impact. So they're thinking a lot about the love for their partner. They're thinking about what would happen if they left? How would that impact their life? How would that impact their job? How would that impact their family, religious, or spiritual values? And what I can see for a lot of HSPs is they get stuck in that analysis paralysis and ultimately end up doing nothing, or they feel stuck. The stuckness is real and it's valid. Like, I don't want to pathologize that stuckness, because often that stuckness can be because there's just a lot of information. It's like information overwhelm. I think also that depth of processing also shows up in risk, right? So if you're in an abusive or toxic relationship, you might be weighing most are risk adverse, right? And then if we link this back to just statistically what we know around abusive relationships and them being the most lethal when you're trying to leave, that HSP with their super amazing risk adverse, risk calculating brain might decide that it is safer to stay than it is to leave. It is safer. And this is something that we'll talk about this later around if you're in this situation or you're helping someone, but I'll go there now. Like, safe is subjective, right? So no one can determine but you what feels safe for you. And so if we think about HSPs who want safety, who want comfort, who are risk adverse, they may feel like they have to stay in that situation, and they may feel that there is a certain time that they have to leave. I want to mention also how the DOES acronym might roll into the O, right? Like, they might get overwhelmed more easily. The empathy, right? When we go on a first date with a partner, if they insulted us and slapped us in the face and did all the things that they do later in the relationship, we would leave, right? But what happens is there's that love, there's that connection, there's all the things. And so I think with an HSP, they're going to be feeling those really deeply, and they're going to need the space and time to process that. And then I think also, if we're overlaying the S, the sensing of subtleties, that is a superpower that is probably keeping them very safe. If you talk to a lot of survivors who have been in abusive relationships, they have gotten highly attuned to their partner's moods, their partner's microfacial expressions, the nuances in their voice in order to predict when abuse might be happening, right? So if you're an HSP, then you're going to be even more attuned to those happening and even more attuned to the shifts in mood, which in turn can be very intense for you and something that you process deeply. So obviously this is simplifying this topic, but I'm curious how you might see, if as we're talking about HSPs and abusive or toxic relationships, what you have thought about it too.
Yes, I have found that all of this, the depth of processing, just thinking of all the possible outcomes and impacts, and then it's so connected again, because that ties right into that in and of itself is overwhelming to do that.
Right.
And then also this empathy, which is also, I think, a way that they can dismiss their own intuition or discount it. Empathy and understanding for their partner, while they had a traumatic childhood, they are struggling with alcohol. And so there's this natural ability that we have as HSPs to really be empathic about another person's experience, even to our own detriment, or even being blinded about what's really happening.
Yeah. Well, and I think about with HSPs, the differential susceptibility and how that shows up in relationships. And really simply, differential susceptibility in HSPs is when they're in a environment that is poorly suited to them, such as an abusive or toxic relationship, they will actually suffer more. They will feel the impact more. I informally just call this the sponge effect. You just absorb more of what's around you,
I love
right?
it. Yeah. That's easy to remember.
Yeah. With my teen clients, I just say, you're really spongy, like you just got to wring out the sponge. And it applies to adults too. Right. So with that differential susceptibility, if you're an HSP in an abusive relationship, you might be struggling more than the next person, right? So that just right, that snowballs into the self-criticism, the blame, the isolation. I think that's a huge hallmark of being in a toxic or abusive relationship, especially as an HSP. But on the other side of differential susceptibility, as I know that you know, when HSPs are in environments where they are supported, they will thrive more than a non-HSP. And I like to really emphasize that because I think that it can feel so hopeless and overwhelming. But time and time again, and I've seen this and I know you've seen this, when an HSP is in an environment, is in a relationship, or is with a skilled provider that is the right fit for them, they can actually start to thrive and flourish greater than a non HSP. And that might be finally connecting to that intuitive guidance that is, and that strength of, okay, it's time to get out, or it's time to change, or it's time to heal.
Yes, I have seen that in my work with clients, literally with what you're describing, Ari, with a client who was able to leave a relationship that was very unhealthy. And I believe that it was after this understanding and realization of this trait and getting the support she needed and connecting with people in her life who were also healthy for her. And she just blossomed and actually went rather quickly, I would say, her once she began to understand the trait and make these subtle changes.
Yeah, it reminds me about how, and this is a vulnerability, I would say. Here you are sharing this exciting story, but I'm going to share maybe it reminds me of a vulnerability.
Yeah, it's fine.
I think a lot of HSPs, because I know you and I have been, and so many people on your show are working to spread awareness around this trait. But even so, I think HSPs are used to being misunderstood. They're used to feeling different. And that can make them, if they haven't done their own research and work around understanding this trait and becoming empowered around this trait, it can also make them vulnerable to being in a relationship where they continue to be misunderstood and possibly abused and controlled. And so that's another way I see this intersection around HSPs and abusive or toxic relationships.
We're going to have to come back and do an episode 2 on this whole topic, Ari, because there's just so much to it. As you're sharing that, I was just thinking about all these other ways that I'm like, I could respond to that. It's like, oh my goodness.
I know. You can see our little depth of processing wheels on overdrive right now.
Yeah, but it's so true. And I just want to say to our listeners that if you are in therapy, if you're a listener here who's in therapy or who's thinking about going to therapy, there's a 50% chance you're highly sensitive.
Yeah.
I will just say that there's a 50% chance. And I would encourage you, if you suspect that you may be highly sensitive, to, do some research, go back and listen to some of the previous episodes on this podcast. Of course, go check out Arianna's website. She has some really helpful, thoughtful blogs that can help you to see if this is perhaps part of your experience. And again, going back to, what we're focusing on, which is this experience of abusive and toxic relationships. While there are some specifics that we are emphasizing for those who are highly sensitive, if you are in an abusive or toxic relationship, the recovery process is still the same in many ways, whether you're highly sensitive or not. And it's just as important and necessary for you to move forward, whether you're highly sensitive or not. You can't skip the recovery or healing process. It's vital to making this change in your life.
Yeah. And as you said, Lourdes, there's such good on the other side of it. And if all you've known is abuse, volatility, and being misunderstood, it can be hard. And right, and these can be the trauma glasses. It can hard to believe that there's hope on the other side and that there's good things on the other side. And I think sometimes as therapists, you and I, we see that every day, but that might not be what everyone else sees. And so just a reminder that there is recovery on the other side. And I wonder if this would be actually a good segue into, if you are in this situation or recovering, what are some things that you can do?
Absolutely. So if someone is listening and they are in this process of recovering from an abusive or toxic relationship, or it's something that they would like to do, what are your recommendations for them?
So I have four. The number one, though, is safety. So if you are in a situation that is abusive, it's kind of like, it's hard to heal when you are actively in a scary environment. So if we think about that amygdala again, and we're trying to help that part of your brain to calm, but you are actually in an environment that is unsafe and you need that part of your brain to be activated to scan for threats, then it is going to be very hard to do the healing. It's not impossible, but it can be difficult. So I often emphasize safety and I emphasize your version of safety, right? And I emphasize this also for the people who love someone who might be in this situation, because what you think of as safety may not be the same thing as safety for them. And so I believe in the show notes, we're going to have a link to the hotline for the national hotline for domestic violence, but there's local resources along the lines of safety. And this is just going back to my days working at a shelter. I think it's valuable to have, sometimes it's helpful for people to acknowledge that their partner might be tracking their activity on their phone or on their browser. So if you are looking up resources for safety, look at it, see if you can borrow a friend's phone or a family member's phone to look it up. And chances are, if you're in this situation, you've thought about this, but this is also something that you can do to help someone, is ask them, how do you keep yourself safe? Because chances are that there's a lot that the person you love is already doing to keep themselves safe, and there's already a lot that you're doing to keep yourself safe. So first thing is safety. The next three things that I think are all kind of on the same level is getting support, getting help, be that from a skilled provider, which I do want to talk a little bit more about finding the right provider, because all the myths and out there, getting community. That doesn't necessarily have to be other people who have survived an abusive relationship, but it can be as simple as, we were talking about HSPs, an HSP group, a therapy group, a 12-step group, a worship group, a religious or spiritual group, just some kind of community, because there is so much isolation and shame that happens when you're in an abusive or toxic relationship.
Absolutely.
And then also, the fourth one is getting educated, getting informed, because when you see the information, it can really validate, it can start to almost create this little Morse code to that inner wisdom inside of you that's just like, I thought this was off. And now I'm learning that this isn't okay. I thought that this wasn't right, but now I'm seeing that what they're doing isn't okay. So just to recap those four things, the first one is safety, and then the next ones are getting support from a skilled helper or healer, community in whatever form, and information and education. Is there anything that you'd add, Lourdes?
You touched on all of that I think is important for this. For me, what stands out the most is really making sure that you are safe. That's so funny. I say that all the time to clients. I feel like safety first. That's the priority, is your safety. And then I think making sure that you have supports that are right for you. If you are highly sensitive, it's very helpful to be working with someone who is informed about the trait. It's also helpful to work with someone who has experience or is informed about trauma. And again, making sure that you're getting quality information.
Yeah. And if someone were to be like, well, where do I get quality information? Usually there are national and local resources. If you just Google domestic violence support, they're going to have the most up-to-date information.
Yes, I agree.
As opposed to other sources, right?
Yes.
That may or may not have statistical research behind it and the anecdotal information. I think it's also, Lourdes, you mentioned when you're working with a healer and a helper, a provider, if you're an HSP, have them understand that. Otherwise, they might pathologize normal reactions that you're having in as an HSP, right? In this context, they would understand it might take longer. It might take a lot of sessions to talk through all the different nuances of what you're feeling. I think also it's really important to work with providers that understand domestic violence or intimate partner violence, because it is so insidious, it is so misinformed, and there's actually certain types of therapies that are contraindicated when there is active domestic violence happening.
Absolutely.
And if I can speak to that, like an example of that, you had mentioned that someone, if they're in an abusive relationship, they might blame themselves and take on what their partner's doing. And they might say, oh, well, I just need to be better at communication. We should go to couples counseling. But actually, couples counseling can make the abuse worse. It can
Yes.
give the abusive partner more tools to control, right?
Yes.
The other partner. So that's why it's important to have a provider who is understandable about intimate partner violence, because they're going to be able to ideally assess if couples counseling, for example, is even appropriate. Does that, I'm sure you've seen that too.
Yes, I have seen that. And another thing to consider is if in this toxic or abusive relationship there is an active addiction,
Yeah.
couples therapy is also contraindicated.
Yep.
But I think that between a good HSP provider, supporter, resource, and good domestic violence resources, then I think you'll be in good shape with the information that you need.
Yeah.
So, Arianna, one more question that I wanted to touch on before we wrap up. Often we have loved ones in our life who we're concerned about because they may be in toxic or abusive relationships. Any do's or don'ts that you have for those who are concerned about a friend or loved one?
I think, the same suggestions that I gave if you're in it around safety, support, information, and community can also apply if you're a loved one. The way the safety applies is talking to that person you're concerned about their safety, and acknowledging that their safety, what you view as safe and they view as safe, is different, right? And so really taking an approach of understanding, how are you keeping yourself safe? How are you keeping the kids safe? This gets complicated, right? If you're a mandatory reporter, right? If you're in a profession where you have to, and that's where, once again, it's so important for anyone listening to be a provider who is versed around domestic violence, because they're going to understand the magnitude of what a report could do, right? So that's a quick aside. But I think also, if you have a loved one, you getting support yourself and being educated is going to be important, because you might understandably think, well, they just need to leave, right? But then if you get support and information and you see that that's actually the most lethal time for that person and the most dangerous time, then you might instead change your tune and be like, okay, I want to support you leaving. How can we do this safely? What needs to be in place? And that person might say, it's not safe to leave until the kids are out of school, right? Until the kids have moved out, or it's not safe until I can find a place to live where my dog is allowed to stay. So I think supporting, if you're a loved one, supporting them in what their version of safety. This is so, I feel like I'm simplifying it so much. And I bet there's people listening right now, the loved ones, that are like, it's not that simple. And it's like, I know.
There's a lot to this. And I want listeners to know that we acknowledge that. And there's so much that does need to be considered. But for the first steps that we can offer in this conversation, first meaningful steps, beginning with safety and having that conversation with your loved one or friend about this is an excellent beginning.
Yeah. And you getting your own support, because if you're a loved one, now let's add this, you're an HSP and you have a loved one, right? That's going through this, right? We could go down that little tunnel, right? But that's where you getting your own support to process your feelings around what's happening for that person, so that you can then not necessarily bring even more to that person than they're already going through.
Yeah, that's so important. Thank you for emphasizing that, Arianna. I hope that for our listeners, you're able to find some meaningful information in today's conversation. And, this is a beginning, and, we encourage you to seek out support, seek out good resources, and continue to learn about this experience so that you're able to navigate it safely and appropriately for yourself or as a support for a loved one or a friend. And Ari, if we have anyone listening who finds himself in this situation of either having a loved one or friend who is in possibly a toxic or abusive relationship, what are some words of wisdom that you might have to offer them?
There is hope on the other side, and that people recover every day from these experiences and go on to live wonderful and thriving lives. And just the encouragement of safety and support as well. And I think also listeners hearing like, you don't actually deserve or have to be in an abusive relationship in order to get love. Love doesn't have to hurt. Love can feel safe. And granted, sometimes love can be scary, but love can feel safe. And that doesn't have to be how you have to get love, is through abuse or pain or manipulation or all the other tactics that you might have experienced in the past.
And for our listeners who want to work with you, learn more about you, what's the best way for them to find you?
Yeah, so my website, which I believe will be linked in the show notes, quietmooncounseling.com. And that's the main way to find me around my work as a therapist, working with HSPs.
Thank you so much, Ari, for taking the time today to share your wisdom and your expertise and insights on this topic. I know that it's going to be really helpful for our listeners. So thank you so much for your time today.
Yeah, and I'm going to add one more thing as far as a takeaway. What can also be helpful for clients is the relationship bill of rights. So that sometimes can also be really helpful for folks, is to look up that resource and Google it, relationship bill of rights. There's probably a lot that comes up, but it's a good reminder around love doesn't have to hurt. You deserve to be safe and respected in your relationship.
Thank you for sharing that, Ari, and we'll be sure to include that.
Thank you.
Take care. Thanks so much for listening to the Women in Depth podcast. I hope it brings you a deeper understanding of yourself and others, and that you found some insights that illuminated and inspired. If you like what you hear, please consider supporting Women in Depth with a one-time or recurring donation. Any amount is appreciated and helps us continue to provide free, quality content for the world. If donating resonates with you, you can find the donation link on today's show notes. You can also follow Women in Depth on Facebook and YouTube, and if you haven't yet, please subscribe on iTunes. Again, thank you so much for listening, and see you next time.